New York City, one of the most famous places on Earth. Right in the heart of the Big Apple is Central Park, and that's where you'll find 23-year-old medical student Katie Friedman. She's one of the many New Yorkers who regularly jog around the park. But those aren't light weights or MP3 players in her hand, they're epinephrine auto-injectors. Katie carries those devices just in case she has a severe allergic reaction and needs an emergency dose of medicine. She's learned the hard way not to leave the auto-injectors at home.
So one time when I went running, I didn't have my epinephrine auto-injectors with me, and I felt a reaction coming, and I didn't have them anywhere close to me, which was a very scary experience.
The body's immune system causes allergic reactions. Normally, the immune system protects against bacteria and other substances that can make you sick. But with an allergic reaction, the body is misdirected and fights against normally harmless things, such as food. Sometimes the fight is extreme.
Hi, Dr. Simpson.
Dr. Hugh Sampson is professor of pediatrics at the Mount Sinai School of Medicine and the director of the Jaffe Food Allergy Institute. He says severe allergic reactions can be sudden and deadly.
Symptoms of tightness in the chest, difficulty breathing, a feeling of constriction in the throat, major wheezing, and if it becomes very severe, they can actually start to feel lightheaded as their blood pressure drops, and then they could actually go into a cardiorespiratory arrest.
What's your monkey's name? Tiny.
Marissa Nobile's world turned upside down after doctors diagnosed her daughter Jessica with a peanut allergy. At the time, Jessica was 4 years old and had eaten peanut butter for most of her life.
But she never actually had a reaction to the peanut. That's what we were so confused, because she was eating peanut all along, up until that blood test.
Marissa had to change her family's lifestyle to accommodate Jessica, and that took some doing. She also lived in fear that Jessica would have a life-threatening allergy attack.
I worried with her in school on, her safety, and I thought about, how was I going to feed my child? And I was very, very scared to tackle this on my own, to be honest with you, because I had to cook not just for her, I had to cook for a whole family and change everyone's diet to keep her safe. And food shopping and preparing foods was a big challenge. And it was very emotional for me. And I remember crying in the aisles, how do I feed my baby?
The transition was also hard for Jessica, who at times would be isolated from her classmates at a peanut-free table because of her sensitivity.
If there was people that were in my class that I wasn't really friends with, they would probably bully me at recess. They would make fun of me because I couldn't eat the foods that they could.
In most cases, doctors use medical history to diagnose a food allergy. If a patient eats a particular food, like peanut butter, and experiences a reaction, such as hives or vomiting, that may indicate an allergy. A skin prick test is also used to highlight sensitivity. But new research shows these tests may not be completely accurate and may confuse one allergy with another.
Now, one of the problems we run into is many people can make this allergic antibody, which we call IgE antibody, to a food or to an environmental allergen, and yet develop no symptoms when they ingest that food. So a big part of the problem is trying to sort out what is it that people have the allergic antibody to and what actually causes symptoms.
To understand the science behind the symptoms, researchers developed a more advanced molecular blood test. It's called the ImmunoCAP test.
In looking at more molecular-based allergy testing, we're trying to get more information from the test. So when we do the general test, we only know whether or not they have allergic antibody to a particular food or substance. When we're doing the getting to the components or the proteins, we're able to narrow down a little bit better whether or not they're likely to react.
Molecular allergy testing breaks food down to its component parts. The risk of severe reactions can vary based on different proteins in the peanut. If a patient is sensitized to one family of proteins, there may be a high risk that the peanut allergy may be severe, perhaps even life-threatening. But if a patient is sensitized to a different family of proteins in the peanut, then the child may be more likely to experience mild or localized reactions.
Studies recently have shown that if we focus on one of those proteins called ARH2, that if an individual makes a great deal of antibody to that single protein, we know that it's highly likely that they're going to have a reaction to that protein, or to that food, in this case peanut. If they make a lot of antibody to another one of those proteins called ARH8, we know that that's cross-reacting antibody from somebody who's allergic to birch pollen, and they can probably eat the peanut with no problem. So whereas if we look at the whole food, it may look like they can't eat it. If we look at the actual component proteins, we get a much better idea of whether they'll react.
Research has shown that of the children who were diagnosed with a peanut allergy, less than 25% had a true clinical allergy. More than 75% could pass an oral food challenge.
Who wants their chef hat?
Me! I want a chef hat.
One of those was Jessica. She had this test this summer and discovered she doesn't have the severe protein and can eat peanuts without fear. Although she does have other allergies, she is now free to enjoy many of the foods she previously avoided.
I went with my mom to Dunkin' Donuts, and we got a big box of Munchkins, and then we got a box of donuts, and we went to my grandma's, and we celebrated there. That didn't make sense, babe.
The Nobile house rules eased up as well. The family can be more spontaneous now.
We went to Great Adventure for the first time without a cooler. We could just go on spur of the moment and do a family day out. And it was a nice feeling that Jessica was able to eat in a restaurant and enjoy, all kids' foods that she's never got to really enjoy.
It just changed everything. It changed her, never mind me, my daughter's attitude. Just seeing her feeling free was, I didn't mind doing anything that I had to do to protect her, but seeing her freedom and seeing her life turn around, you can't, there's no way to describe it unless you're a dad and watched your daughter go through the allergies.
It was the most rewarding experience that I think I've ever had, of a weight lifted off the family.
I feel happy because it changed mine and her life because she can have more foods.
Katie Friedman, on the other hand, does have severe allergies. She's had frightening, life-threatening reactions, but she now knows what to do to protect herself. As a medical student, the science behind the molecular allergy testing is fascinating to Katie. But as an allergy sufferer, the research is personal.
And I think it's amazing. I think it could really change the face of allergy.
Although Katie's been living with severe allergies for more than 20 years, she hasn't let them interfere with her life. She and her family have traveled abroad. She also spent time away from her family at sleepaway camp. Katie looks forward to more research breakthroughs that will help to better manage her allergies. But until those breakthroughs come along, she has some advice for others with severe allergic reactions.
It's always important to be prepared and to know what your options are. Take your antihistamine, take your epinephrine autoinjector, and seek medical help immediately. And then have a successful and happy life.